So good afternoon from Tokyo, and thank you very much for joining our knowledge forum titled Global Health at the Crossroads, in Japan's leadership in an era of declining global aid. This is jointly organized by JICA Ogata Sadako Research Institute for Peace and Development, and also with Japan Center for International Exchange. My name is Itoh Satoko. I'm the principal research fellow at this research institute, and I'll be your guide today. So the landscape for development cooperation in global health is at a turning point right now. Following aid cuts by conventional key donor countries, many international organizations are compelled to revisit or scale back their activities, while low and middle-income countries are increasingly taking initiative and exerting leadership to secure funding for health and development in general. Japan has played a crucial role in advancing global health through diplomacy, as well as through bilateral and multilateral ODA. And today, we are going to re-examine how Japan can contribute to global health in this time of uncertainty, together with excellent set of speakers from government of Japan, business sector representatives, and also civil society and partner countries. So stay tuned for what Japan has to offer to global health. So without much ado, I would like to invite Mr. Yuichi Oba. Mr. Yuichi Oba is the Deputy Assistant Minister in International Cooperation Bureau of Ministry of Foreign Affairs, Japan. More importantly, he's the ambassador for global health diplomacy, and he sits in as a board member representing Japan in global institutions like Global Fund and UNITAID. So there's no more qualified person to open today's seminar. So Mr. Ambassador Oba, please take the podium.
Takeda-san, thank you very much for your kind introduction. Excellencies, distinguished participants, my name is Yuichi Oba. I'm Ambassador for Global Health Diplomacy and the Deputy Assistant Minister of the Ministry of Foreign Affairs of Japan. And I was also the Senior Vice President of JICA until last October, so I'm glad I'm back here at JICA. And I'm honored to make opening remarks at this important knowledge forum today. At the outset, I'd like to express my sincere gratitude to JICA Ogata Sadako Research Institute for Peace and Development and Japan Center for International Exchange, JCIE, for this kind invitation. Global health is with no doubt a critical issue that directly impacts the lives and well-being of individuals. Beyond that, it serves as a foundation for the economy, society, and security of the international community, including Japan. Prime Minister Takaichi Sanae values health and medical security, recognizing the protection of people's lives and health is important for national security. Infectious diseases know no borders. Global health requires more unified and cooperative international effort in the current international landscape we're facing, including declining public funding for global health, a deteriorating security environment, and growing financial constraints. Furthermore, we need to strengthen and reform global health architecture in order to tackle current health issues as well as to prevent, prepare for, and respond to future pandemics. Today, let me be crystal clear that Japan remains committed to global health, which is fundamental to human security. Moving forward, we will continue to position global health as one of our key diplomatic pillars and will demonstrate responsible leadership to address global health in the international community. Today, I'd like to take this opportunity to highlight two main aspects of Japan's global health diplomacy. First, Japan promotes a distinctive approach to support our partner countries. We work hand in hand with Global South countries by providing finely tailored support for their needs, while encouraging them to address the health problems through their own efforts in a sustainable and self-reliant manner. To achieve UHC by 2030, particularly through strengthening health financing systems in each country, Japan launched the UH Knowledge Hub in Tokyo in collaboration with the World Bank Group and WHO during the UH High-Level Forum held last December. The hub provides capacity building on health financing for senior officials from finance and health ministries of developing countries, as well as supporting the effective implementation of health financing policies led by these countries. We are advancing these efforts so that the countries can better mobilize domestic resources and achieve more efficient use of funds through robust public financial management towards UHC. Secondly, Japan will continue to demonstrate leadership in advancing multi-layered support. Japan promotes a diverse range of support, including financial contributions to multilateral frameworks such as the Global Fund, Gavi, UNITAID, and WHO. Furthermore, our bilateral ODA, primarily implemented by JICA, along with grant aid in collaboration with international organizations and the co-creation for Common Agenda Initiative, also play central roles in Japan's global health initiative. In addition to public funding, the role of the private sector is indispensable in our efforts in global health. Public funding can play a catalytic role to mobilize and stimulate private finance. And we will also encourage the utilization of advanced Japanese health products and technologies in a bilateral and multilateral assistance as much as possible. For example, last August at TICAT 9, Japan announced the investment promotion package for sustainable health in Africa. This initiative serves as a concrete example where these two aspects of Japan's global health diplomacy converge. Under this initiative, Japan is fostering long-term investment in Africa's health ecosystem, aiming to unlock its full potential. The fundamental human aspiration to protect the health and dignity of our loved ones should be a universal value that unites us all across the international community. Now the international community faces increasing division and confrontation. Solidarity is more crucial than ever. I firmly believe global health holds strong potential to be a powerful foundation that fosters cooperation and strengthens trust and bonds between people. That is why Japan will continue to demonstrate its unwavering leadership in the field of global health by sharing our experience, expertise, and strengths with the international community and by supporting efforts to strengthen health system. Together, let us champion global health initiatives to achieve human security, protecting the lives and dignity of every individual, and building a future where no one is left behind. Thank you very much for your kind attention.
Thank you very much, Ambassador Oba, for the powerful and also very encouraging commitment and that Japan will continue to lead the global health challenges. So now I'd like to ask Dr. Omi to give us, share with us his wisdom in navigating this challenging time for global health. Brief introduction, Dr. Shigeru Omi is currently a chairman, board of directors of Japan Anti-Tuberculosis Association, one of the long-term partners of JICA in the global fight against the TB, still a big health challenge in many countries. But he's also known as serving as a WHO regional director for the Western Pacific region, UPRO, between 1999 and 2009. And he still holds many important international functions and roles. And in Japan, he's more probably known as the chairman of expert committee of a COVID-19 response. And thank you for being the kind of voice of science throughout the challenging time of COVID-19. And I think we are kind of excited to learn from your wisdom about the how we should navigate this difficult challenge, and also how Japan can contribute in that aspect. So, Dr. Omi, please take your floor.
Okay. So first 10 years I worked as a responsible person in charge of a communicable disease control. Later, I worked as a regional director of WHO for the Western Pacific region. So based upon that experience, I'd like to share my view on this very important. But before anything else, I'd like to thank the organizers for inviting me to this very important forum and congratulate the organization for picking this topic up. This meeting comes at the exactly right timing. And I'm sure that many participants are, if not all, are concerned about the decreasing involvement of one of the most powerful nations in the world in global health. As someone who has worked for WHO many years, I have to be candid. I am very much disappointed about this situation. Now, can I have the first slide? Oh, I'll do that. I have to. Well, let's start with the impact of a U.S. withdrawal from the international organizations, including the World Health Organization. I believe, whether you like it or not, negative impact is already felt on the ground. So many examples I can cite, but given the time constraint, I'll pick up one or two. Many countries' effort to control, for example, communicable diseases, have been already affected by this policy shift. Now, case in point is the tuberculosis control, which I'm now responsible for. Countries are already facing problems, many problems, but such as insufficient supplies of medicine and diagnostic kit. And also they are faced with reduced capacity in the area of surveillance and the response. Now, many people in and out of the country may assume that communicable disease like tuberculosis is a disease of the past. But in this context, I'd like to share with you one slide. Let's see, can I show this one? Red one, where is this one? This far left high blue bar indicate number of deaths due to Spanish flu, which occurred during the First World War. And then I'm sure that many of you are familiar with the word Asian flu or Hong Kong flu. And later, this one, SARS in 2003, or this one, I don't have to move this one. SARS, and afterwards, this novel influenza to H1N1 and the SARS. Then right far, 3 bars indicate number of estimated deaths due to this COVID-19. Now, if you look at the orange area below, this illustrates estimated number of deaths caused by tuberculosis over time. If you look at these bars and the orange area together, you'll immediately understand tuberculosis is not a disease of past at all. On the contrary, this disease remains #1 killer among the communicable diseases affecting adults, except the 3 years, the right far, 3 years of the pandemic. So this is a reality that many people are not aware of. Now, another example of a negative impact of the shift of the policy of one of the biggest country. Because of the close collaboration between countries and the supporting partner agencies, country, including US, of course, Japan is part of it. Even small outbreak on the ground before war contained on the spot because of the international collaboration, while there were still small fires before it became serious fire. Now, we have to face with the reality that with decreasing support from the international community, it may be possible that international capacity to detect and respond to major outbreak, pandemic, is affected. Preparedness pandemic response is another area of concern. And some of you may ask whether next pandemic will come or not. Issue is not whether it comes or not. Issue is when it comes. So we have to prepare. Now, through the COVID-19 experience, we all know, we all learn that once a pandemic breaks out, its impact on society, economy, and even human lives, let alone education of youngsters, is immeasurable. And I'm sure that many countries' GDP has dropped substantially because of this COVID-19. Therefore, I like to emphasize that the pandemic should be viewed not just a health issue, Minister of Health is responsible for, but as a matter of national security, as mentioned very eloquently by Ambassador Oba a while ago. Of course, I am not an expert in politics, so I don't know what is going on in the political world in detail. But my feeling is that US inward-looking policy has tacitly signaled to other countries that similar inward sort of approach are acceptable. This is the tacit signal, tacit signals that is given by the country. And this my country first mindset has been, in my view, spreading very slowly but silently across many countries like a infectious disease. That is my observation. Now, let's talk about Japan's past contribution, whether it's a good or not. I'm sure all of you agree that Japan's ODA has been appreciated, highly regarded by international community. During so many years of working for WHO, I saw many people working in JICA, people working in USAID, USAID, Rotary International, UNICEF. All those organizations are very grateful to what the Japanese government, JICA, and other civil society has done in the past. Now, why Japan's ODA support has been appreciated by so many countries, agencies, or international community as a whole. Of course, I'm not an expert in analyzing the reason. There are many reasons behind it, I'm sure. But if I single out one phrase, it will be like this. Yeah, why? Well, this, can you look at the bottom? Because of synergy between track record and the very characteristic of Japan's Overseas Association. Track record is so obvious. And also, Japan's ODA has a very special characteristics. That is a bit different from other. I will not mention which country, but a bit different. That is my observation. Now, let's start with the track record. Now, communicable disease prevention and control is certainly one of the areas, so many areas, but certainly one of the areas that Japan has made substantial contribution. My observation is that in addition to what they call multilateral support, which includes global funds, in addition to multilateral support, including the global funds, JICA has established long-standing collaboration network with many countries, with Africa, with Asia. And my observation is this bilateral support also, like a multilateral support, has borne many fruits that we should be proud of. And the Noguchi Memorial Institute in China, in Ghana, deserves, for example, special attention. And of course, maternal child and also universal coverage is another area we should be proud of. Now, let's pick up polio as one of the examples of the communicable diseases. I'm sure all of you are aware, 30 years ago, polio cases, polio virus was rampant. In Asia, except Australia and Japan, other countries, including Korea maybe, sorry, virtually all the countries have reported polio cases, really rampant, everywhere. But now, whether you believe or not, only 2 countries still reporting polio cases. And the 2 countries are Afghanistan and Pakistan. And the number of reported cases are less than 100 for both countries. And my understanding is that the quality of surveillance, polio surveillance, what we call AFP surveillance, its sensitivity is very good, has become improved substantially over years. Under this improved surveillance, level of surveillance, number of cases reported from these countries less than 100. If the number becomes 0, we can comfortably believe that we reach 0 status. And because of the hard work of the volunteers, supported by the international community, hard work of the countries themselves, for during 30 years, we have come this far. Only 2 countries. And it means we are now in a very, very last stretch of our fight against the polio. And I'm sure that you know that because of 2 countries I just mentioned, because of only 2 countries I just mentioned, all the children, including this country or US or Europe, all children have to continue to be vaccinated against polio. It uses a lot of financial resources. We have to understand that one. If you get rid of diseases once and for all, we can save a lot of money and we can give a gift to the next children. Now, next one, the MCH. I'm sure many of you are aware that what we call maternal and child health handbook in Japanese, Boshoken Techo. This is developed by Japanese experts. And this handbook is utilized, I understand, more than 30 or 50 countries in the world. This is another marked contribution. And the UHC, recently Japan has led a very important meeting here in Tokyo, right? So this one everybody knows. All the countries are looking at Japan as to how we improve our health system. Now, I mentioned this already track record, but now let's come to what are the characteristics of Japan's ODA? Of course, it is very difficult to show this in one slide, but I tried. First characteristic is collaboration and the support have been based on the needs of the recipient countries and on the principle of equal partnership rather than what we call overbearing attitude. Some countries' ODA is like that, but Japan's characteristic, Japan's ODA is equal footing. This attitude is very much appreciated by many partner countries. Now, second, while Japan's financial contribution have been appreciated. Thank you very much, JICA and the Gaimusho-san, and the Koryo as well. But in addition to that, it is, in my view, face-to-face technical support provided by Japanese experts on the ground. This is very important element. Now, I think this slide is about today's one of the most important topics. What our support should be in the future. In my view, the following principle has been met for future support. And of course, many of the principles have been already met, but always there's a room for improvement. I go one by one. Obviously, the support should deliver tangible outcome. This is no need to say that. Now, second one is also very important. Ensure value for Japanese taxpayers. Now, in these days, many people believe that ODA is a waste of money. So some of the Japanese people are not convinced. So we have to do some corrective action. Ensure value for Japanese taxpayers so that we should be able to explain to general public what the kind of support we have provided, what kind of impact, positive impact it produced. So in a simple words, we have to explain. And Japanese citizens, in my view, are smart enough to understand this is not a waste of money. It will contribute to the Japanese society as well as the international community. So this is very important. And then maybe Shibusawa-san may touch on this fourth one. Oh, sorry, I skipped the three. And the third one, focus on areas where Japan has proven achievement, expertise, and human resource. Also, this is needed to say that. Now, fourth one is the public-private academic collaboration. Civil society, private sector should play even more active role in the future collaboration so that the Japanese society, even economy, will benefit from this collaboration. And five, respect the changing role of partner countries. Fifth is very important because many of the countries now seek to be designers of a new international sort of order. founded on sovereignty, dignity, and mutually beneficial cooperation. They don't like to be told by rich countries what to do. They like to be also very designer of new architecture. I think we have to respect, and they deserve it. So this is a very important element for future support. Now, fixed one coordinate support with the international community and the Japanese countries themselves. Of course, this is I don't have to explain. Now, priority areas for future support. Well, pandemic risk preparedness is already I mentioned, but this universal health coverage, UHC, many countries, developing world, are looking to Japan in this area because they like to know the experience Japan undergone in development of this robust system. Of course, if you look at the Japanese system of this Japanese health system, there are a lot of the areas for improvement. But if you look at the USC from the overseas, Japan can offer a lot. Of course, there is an ongoing need for improvement, but this is the area. And control major communicants I mentioned. The another one, comprehensive NCD prevention control. I'm sure you know that even what we call developing world, NCD like diabetes is rampant, whether you believe or not. Diabetes, which is regarded as a disease of affluent, it is rampant. So NCD is another area that we can make by the further contribution. Now, conclusion. This is my assessment. I already mentioned health is should be regarded as a part of national security. And I understand our government already planned to increase defense budget by 2 or 3%. I am not expert in making a judgment whether this is relevant or not. That's not my point. But if the government increased in defense budget by 2 or 3%, at least part of the increased portion should be allocated to global health. And I like to emphasize, many countries outside of Japan are doing the same thing regarding health as a national security. So they use defense budget. So this is one thing that the government is requested to consider very seriously. Now, I think my last the recommendation is that given the experience, credibility, and track record, Japan is expected to play an even more active leading role in global health in today's difficult moment. The world has, in my view, emerged geopolitically very, very difficult time, characterized by fragmentation rather than on solidarity. And I believe precisely because of this, we must draw on unique strengths of Japanese ODA to make a further contribution to global health. Thank you very much for your listening.
Thank you very much, Dr. Omi, for once again for very powerful keynote message. I think that message set the kind of overall tone of today's seminar. And I personally learned a lot from the keynote, but those guiding principles the tangible outcome, accountability for taxpayers, focusing on the comparative advantage, nurturing public-private partnerships, and the respecting the changing role of our partner countries and coordination among our partners. I think at least I want to keep it as our own guiding principle for the future. Thank you very much. So I'd like to move on to the next program, which is the panel discussion. We have a powerful set of panels today. So I'd like to go one by one in the first round of session. So the first panelist is joining us online from Ghana. Dr. Patrick Kuma-Aboagye. Dr. Aboagye, can you show your face?
Yep.
Dr. Aboagye, thank you very much for joining from Ghana. It's early in the morning in there, but I really appreciate your effort. Let me quickly introduce Dr. Aboagye. Dr. Aboagye is a former Director General of Ghana Health Service of Ghana, which is one of the largest public health institutes in Africa. And he served as Director General of Ghana Health Service from 2019 to 2025, quite recently, including the time of difficulty navigating the COVID-19 situations in Ghana. And Ghana is one of the long-standing partner in health and development in general. So, we heard a lot of good things from Dr. Omi, but I'd like to ask Dr. Aboagye to give us a kind of a reality check from the low and middle income partner country perspective. So my question to Dr. Aboagye first is, how a current global development perceived from the standpoint of a low and middle income country, both risks and opportunities, since Ghana is taking a leadership in shaping global and health and development financing these days, all the eyes are kind of focusing on Ghana, what Ghana is saying. And the second question is, what impact did in partnership with Japan has achieved to date, and what are the expected moving forward? So those are the questions for you. Thank you very much, Dr. Aboagye, joining from Ghana. So floor is yours.
Thank you very much, and good morning from Accra. I want to thank JICA and the JICA Ogata Research Institute for inviting me to this very important platform to share my views. I think Dr. Omi has said a lot, so I may have to just brush on some of the things. I think with the growing interconnectedness of the countries in the world, international cooperation is extremely important, and it's very important that we need to keep that apart. However, empowering countries and sub-regions to own their strategy and also provide local issues based on their own experiences is very, very important. Development assistance for health has metamorphosed in several ways. I mean, we are talking about decline now, but we also remember in the days of SWAP when most of the ODA was being projectized, and that we had to come in with a sector-wide approach to allow for ODA to support government program. So the current situation shows us poses a threat to Ghana, because overseas development assistance for health has done a lot for the world, particularly the global south. Morbidity and mortality has reduced significantly, and I'll later give you some figures, in the last 20 years, mainly as a result of local action and, most importantly, partner support through ODA. So the perceived threat is the reversal of all these gains that we are worried about, which is already happening in many countries. We also have the large life-saving interventions such as ARVs, malaria eradication, etc., which are all at threat. Childhood vaccination, maternal and child health services, among others, are still under serious threat with this current situation. And as Dr. Omi said, this will have an impact on other sectors of the economy, as we saw in the times of COVID. During this period, Ghana has made significant improvement with support of ODA, and particularly from support from JICA. We have increased our full, in the last 20 years, increased our fully vaccinated children from about 18% to about 75%. We have also reduced the number of children who were vaccinated along from about 15% to 2%, all because of international cooperation. We have reduced our maternal mortality significantly by about 40–50%. Under 5 mortality, infant mortality has dropped from the last 20, from 11 infant under 5 mortality from 11 per 1,000 to 40. Infant mortality from 64 per 1,000 to 28 per 1,000. And newborn mortality from 43 per 1,000 to 17 per 1,000. And these are no mean achievement. I believe that this has, not just from the local, but has been with the international support, particularly ODA, and countries like JICA, Japan, which have been our greatest supporters. All these challenges also mean that once there's decline in ODH, maternal mortality is likely to go up because we are going to now have to play less emphasis on promotive and preventive care. We are going to have to deal with NCDs in future at a much higher cost instead of preventing them. We're going to have anemia in children and stunting for children under 5. These are all the threats that was among many. These are the few among the many that we have. However, there are opportunities, as was said. It also has now pushed the pressure on our government and our countries in the global south to greater drive and increase domestic resource mobilization, such as introducing health insurance services, among others, and to ensure that we have enough resources to make up the shortfall. There's also the need to enhance efficiency. It's going to be pulled to help us move, and that we want to look at. We may be pushed into looking at pool procurement at a national level or the regional or sub-regional level, digitization to create some more effectiveness, and ensuring that our skilled health workers are well skilled so that we can have good output from them, and increase access to primary health care. Currently, the government of Ghana is trying to introduce a free primary health care program. We are hoping that this will also going to draw more of our cases, where preventive and promotive actions will be enhanced, and more cases will be seen at the primary level, and that will lead to reduced cost of care. There's also going to be an opportunity now, a more drive for us to have a more South-South cooperation to share resources and share ideas. And most importantly, we will need to now move. Government will have to ensure that PPP, private public partnership, is enhanced so that we can they also come into. I'll give you an example. When we introduce health insurance in the country and we also allow the private sector to participate, we are seeing a significant number of private facilities appearing in the country, especially in the urban areas, really easing the pressure on government to continue putting up facilities. Japan has been a very important stakeholder, and as Prof. Dr. Omi said, in my view, Japan ticks all the boxes of an ideal partner because they align with country priorities, they co-create with you, they support health systems and primary health, which are the bedrock of improving healthcare in the country, and build capacity for sustainability. There are many examples that I can think about the time, but I'll just look at the maternal and child health record book. We call it a record book, but in Japan, it's a handbook. It's now being used nationwide, but what did we do? We had to sit down together after a research with JICA. We did community engagement, community mobilization to see how we can make it. Now, we finally finished it. And through that, we introduced additional services like nutrition clinics among ANC, and also engage private sector. Currently, it is nationwide. Every facility in the country, public, private, teaching hospital, they are using the same book. We are now being able to get private sector. I've seen the need to even support their printing, and so because those are key challenges that we have. They have helped us in our primary healthcare with a lot of support from the community-based placement services, which is the lowest unit of care in the country. And not just in training capacity, but also in building the infrastructure that we have both agreed on to support, and that has really improved our use of primary healthcare. And it became very useful during the COVID response because we had systems in place at the community level to quickly respond. Noguchi Memorial Institute for Medical Research has already been mentioned. Is one of the iconic research centers in the sub-region. It was very useful during the COVID era, and we're able to quickly start testing because of Noguchi and the capacity builds and the supplies and support that they continue to receive from Japan. So these are the key things that I can respond in terms of. There are many other support examples of things that Japan has done. They've given us ambulances, they've given us even water tanks to be able to support our services and continue to help us with our infrastructure, training, and most importantly, capacity building for both middle and senior level people in the country. So thank you very much. This is my response for further questions.
Thank you very much, Dr. Aboagye, for very good interventions and sharing, how the current the changes, abrupt changes in the landscape of global health is really affecting or threatening the health improvement in the past, as well as how the countries like Ghana is responding through domestic resource mobilization, application of technology, and public-private partnership, and so forth. And also sharing your experience working with Japan as a partner, focus the examples of maternal and child health handbook, and as well as our long-standing cooperation for Noguchi Memorial Institute for Medical Research. So thank you very much for those interventions. So next, I'd like to turn to Ms. Itoh from JCI. JCI is one of the co-organizers for this event. So I really thank the JCI for joining us in organizing this seminar. And brief introduction of Ms. Itoh is that she's the managing director of Japan Center for International Exchange. And also she's the director of Friends of the Global Fund Japan. And she's supervising the JCI's work on global health and human security program, which is basically a platform of public-private kind of engagement for all the major global health stakeholders in Japan. And we, appreciate that effort because that really impacted how we behave in alignment with others. So thank you very much. So I'd like to pose you questions. As a long-term convener of a high-level public-private platform for global health dialogue in Japan, and JCI has been working to mobilize political will and public support. Can you share with us what worked and didn't work? And do you see any changes, both opportunities and threats, when global solidarity around health is being challenged? And how should Japan adapt to this new reality? So, floor is yours.
Thank you for, can you hear me? Thank you for that question. And first, let me say it is JCI honor to be co-hosting this forum with JICA Ogata Research Institute at this critical moment. It is very, very timely. Thank you very much. Japan's commitment to global health has expanded enormously over the past 25 years. That's not something unique to Japan. In fact, most of the G7 nations sharply increased their commitment to global health after 2000. But Japan is well recognized by having played some important roles, such as helping the creation of the Global Fund or advocating for UHC, as Dr. Omi mentioned, and most recently by establishing the UHC Knowledge Hub in Tokyo. And within Japan, global health has been well recognized and an important part of Japan's soft power by our policymakers. So what made this possible? In my view, the biggest driving force was multi-stakeholder collaboration within Japan, as Takizawa-san kindly mentioned. If I may say so, my organization, JCIE, has played a certain role in creating the ecosystem to connect parliamentarians, bureaucrats, civil society, and aid experts, academia, and private sector as well, by creating committees convening dialogues and making policy proposals, and then they carry out advocacy. So these efforts elevated global health on Japan's foreign policy agenda. So we are proud to be able to play a catalytic role to connecting experts and making the global health constituency visible in the eyes of the Japanese policymakers. Now we are at the juncture where we are seeing global trend towards aid cut. How can we sustain Japan's commitment? And Takiza-san, you asked me if I see any changes. Yes, I see two different thoughts among policymakers. One is, oh, this is the opportunity for Japan to step up. Japan should fill in the vacuum before somebody else comes. Second one is, oh, let's cut health ODA as other G7 nations are doing. Partner countries needs to become more self-reliant and not to depend on external funding, etc. Both are valid arguments to me. So the equal question, the real question is how we can combine these two ideas and turn this crisis into opportunity for Japan. So I'd like to propose three things. One is prioritization. Second is a tailored approach, as Ambassador Oba mentioned, tailored approach for health sovereignty. And three is the new financial source for health ODA. Prioritization. When money is tight, we have to prioritize. This is common sense, particularly for private sector, right? How do we prioritize? We should ensure money is spent where we have the greatest impact. These days, we tend to discuss too much about how ODA serves national interest or Japan's visibility. But this is not our goal, true goal. The true goal is the health equity, saving lives, not Japan's visibility. So this should be the criteria for prioritization. Second, tailored approach. As President Mahama of the GAP mentioned in Accra Reset, it is time for shift from aid dependency to health sovereignty. I think Japan is willing to and then ready to contribute to this shift. But I think we have to be a little careful because the context is different from country to country. And there's no one-size-fits-all approach. So many low and lower middle-income countries will still depend on ODA, and donor support for health surpasses government health expenditure. So we need to tailor the approach, and this may be the area that Japan has some advantage. Third is new funding sources. Again, when money is tight, we should explore other sources of funding. So we need to work with private sector and philanthropists to explore funding stream that can supplement health ODA. And we need to look at innovative finance like debt swap or blended financing. Also, the so-called sin tax or health tax that are discussed globally could be applied to Japan as well. Also, we may need to review the sectoral balance of Japan's ODA. The largest share of Japan's ODA goes to infrastructure project, mostly through loans, while health, education, water sanitation are not necessarily the top priority. What we can do. And thank you, Omi-sensei, that your board proposal to use the defense budget, that is another way of new sources. So I think it is high time for everybody in the global health community in Japan, public or private, to rethink our priorities and come up with new tools to ensure Japan's global health strategy will be impactful moving forward. Thank you.
Thank you very much for very insightful interventions. I think those the things that you proposed, like prioritization, tailored approach, and new funding sources. I think those are the things that we have to keep in mind in shaping how we can approach the challenge of global health. So thank you very much. So next, I'd like to turn to Mr. Shibusawa, Ken Shibusawa. Mr. Shibusawa is the Chief Executive Officer of Shibusawa and Company Incorporated, as well as the Chief Executive Officer and Capital Chairman, Commons Asset Management. So basically, he's a private financier or investors. But he's also co-chair of Impact Investment Initiative for Global Health, or in short, III for Global Health, which is an initiative launched at the time of G7 Hiroshima Summit back in 2023. So, whenever I kind of disappointed or this kind of the distracted with how market forces work against the vulnerable people and poor people, I try to look to you because you are trying to bring in the where money meets morality. So I really respect your work. But my question today for you is specifically for related to global health. So how is Japan promoting private sector-led financial resource mobilization for global health through the III for global health established at the G7 Hiroshima Summit? And what are the achievements so far, and what is needed to unlock the full potential of private finance for global health impact? Thank you very much. The floor is yours.
Thank you very much, Takuza-san. I want to also thank the organizers for this wonderful event, inviting me, and also for the participants. I see there's over 250 people online, so thank you very much for the opportunity to speak. As Takuza-san mentioned, I represent the business private sector investors, the bad guys. But there are some good guys. Many of you may have heard of this concept called III, Impact Investment Initiative for Global Health. What it is it's an initiative not to replace aid or assistance to global health, which is obviously a very important source of funding, but I feel a way to supplement the financing within the global health value chain. Many of you may have heard this concept of impact investing. What is it? Well, it's basically an investment, so it's for profit, but with the intent to provide solutions to the environment and society. The key word there is intent. So this initiative, as Takuza-san mentioned, was launched during the, it was endorsed by the G7 summit of May 2023. A little bit of background information why this happened in Japan is actually one of the, I think the motivation by the government was to include the private sector into this global health strategy as a growth strategy. Back in 2019, a little bit before the COVID broke, I was part of this coalition called the Business Leaders Promoting Global Health, which is a group of about 14 business leaders in conjunction with the Gates Foundation. And we made a presentation to Prime Minister Suga. One of the actually the recommendations was actually what Itoh-san mentioned, was actually to double the allocation of global health in ODA. When I presented the paper to the then Prime Minister Suga, I said this is not just about aid, but it's actually a growth strategy for private sector. I think that might have sparked a little bit of a aha inside of his head. So a couple months later, I was asked to be a part of this, what's it called? Global Health Strategy Working Group, which Itoh-san is also a part of. And within that framework, I mentioned this concept of impact investing as a way of attracting new forms of capital into global health. And so we launched this, so we were able to get this language in the communique at the G7 Hiroshima Summit. And a couple months later, as you can see in the UNGA in September, we were able to officially launch this at a very high level event when Prime Minister Kishida came, Bill Gates came, Dr. Tedros came from WHO. So it was a very, very high level event. I'm one of the co-3 chairs of this initiative, along with Dr. Ayode Alakija from Nigeria and Mr. Steve Davis from the United States. And it's basically a partnership of many investors, corporations, DFIs, and foundations. And the Secretariat is the Cabinet Secretary of the Government of Japan. We have three pillars that we established. First is outreach, basically expanding awareness that impact investing can work for global health. Second, which is the important part, is to come up with a common language for impact investing, which is basically the IMM, impact measurement and management. This is a very important part of actually the bringing this forward initiative forward, because impact investing sounds like a very, very nice word, and everybody says they have impact, but what actually is impact? We should be disciplined on what that is. And third is, if you really want to make changes, in the ecosystem, global health, obviously, well, you need the government to make incentives to do this. And so we have made policy recommendations in that fact. This is our timeline, so I won't go into details, but we started out with 37 partners in 2023 in September, mostly wearing the Japanese flag. But currently, as of December 2025, we are 124 with a diverse membership. As you can see, still a lot of Japanese flags, but it's not just Japanese flags. There are other countries represented. But the issue we have with the last 3 years that we've been in this initiative is that actually many of the partnership is from the global north, and we feel, especially with Dr. Alakija, that there should be more representation from the global south. As you can see, of the 124, there's only 9 from Africa, 2 from Oceania, 0 from Latin America, several from India and South Asia as well. But still, primarily a global north initiative, so it should be more of a global initiative by including the global south. We do have some areas that we were successful in actually creating an ecosystem where investors and the startups can meet. Soro Technology is a Japanese startup in areas of vector control using drone technology and their AI programming. And there's a relatively small startup, but Nippon Seimei, Nippon Life was also a member, and they were able to actually come and give financing for one of the earlier rounds, which is not common because it's for a big financial institutions to make a commitment to a small startup is not that common. But because they were both part of this initiative, I believe that they were able to come up with this happy marriage. Another is AAIC Investment. This is a Singapore-based venture capital, but they have made investments. It's actually a Japan fund. It's based in Singapore, but as it says here, they have made more up to 40 investments, primarily in East Africa, and so there are some of this sort. That kind of success models as well. There are other impact investments in our correlation, most prominent being Leapfrog, which is a very prominent impact investment fund. Also the former AXA management, which have a very, very impressive track record in global health investing. We actually, the first pillar, in terms of outreach, having the conferences, we do a pretty good job. People gather, and this is some scenes from I believe this is from TCAD, and this is from TCAD, and so we get a lot of excitement in our conferences. So that's very good. But one of the challenges is most of the people, and I believe probably for this webinar as well, come from the global health sector people. And when they hear the word investor, they're gonna go like, "Ooh, investor, new financing," as Itoh-san mentioned, and they get all excited. But investors have their own parameters on what's investable or not, and so I think there's that reality check that needs to be going forward. And one of the initiatives we need to be going forward is to increase the participation of the investor side into our initiative. I believe in that respect, this working group that for impact investment management, they've put together a practitioner's guide, which is still in the early stages, and I think we're in the process of actually using it so that you could put it into practice. But this, I believe, is a very important part of the puzzle. And last, from this trip from the III is we do put together annual reports. And also we have put together in the third pillar policy recommendations to the government. Not sure if any government is ready to commit on our recommendations, but as I mentioned, a lot of the initiatives can start from the private sector, but unless the public sector say, hey, this is important, we need to make a policy implementation on this, we can't have the impact that is deserved. Let me just wrap up there and pick up later on the question. Thank you.
Thank you very much, Mr. Shibusawa, for, again, very insightful interventions. I think you're a good guy.
Thank you. You're a good guy too.
Thank you. So thank you for enlightening us about how this III is really growing with over 120 membership and still growing. And thank you very much. And a lot of the good investment is already taking place. So I'd like to turn to Dr. Nakagawa as the next panelist. Quick introduction. Dr. Sachiko Nakagawa is the managing director of Japan Pharmaceutical Manufacturers Association. It's basically an association or collaboration among the major Japanese pharmaceutical companies. And she's also a vice chair of the Council of International Federation of Pharmaceutical Manufacturers and Association. This is basically an international body of association of the pharmaceutical industry. So. And I think she has worked in the forefront of advancing the balance between vigorous private sector R&D and the well-being of society, working through the various international partnerships as managing director of Japan Pharmaceutical Manufacturers Association. So I have a privilege of working with you in the past year at the time of United Nations General Assembly when JPMA hosted a seminar, a side event promoting the Japan's contribution for NCD challenges. So I really appreciate what you're doing from the private sector perspectives. So I'd like to pose some questions to you, which is, how have private sector-driven innovations from Japan contributed to saving lives and promoting health around the world? And what is needed to further encourage Japan's pharmaceutical industry for more engagement with global health challenges? So, the floor is yours.
Good afternoon, distinguished guests. I'm Sachiko Nakagawa, Managing Director of Japan Pharmaceutical Manufacturers Association, in short, JPMA. Today, I will share how Japan's pharmaceutical innovation ecosystem contributes to global health, especially in an era when global and tightening and co-creation with low and middle income countries, LMICs, has become essential. My message is simple. Innovation has impact when it is designed to reach people through partnerships, access strategies, and resilient supply chains. JPMA is a network of research-driven companies that work closely with global associations such as IFPMA, Pharma in US, and FPA in EU. Through these partnerships, we engage in strategic advocacy to advance access, innovation, and regulatory harmonization. This international platform allows Japanese companies to align R&D and access efforts with public health priorities and to collaborate more effectively with governments, academia, and civil society. On this foundation, let me highlight concrete contributions from Japan that already make a difference in LMICs. Across entities, Emerging infections, tuberculosis, AMR, and COVID-19, Japanese companies have delivered tangible results. For NTDs and parasitic infections, Japanese innovations have helped expand treatments for lymphatic filariasis and schistosomiasis, including child-appropriate formulations that are practical in hot and humid climates and should climate. For emerging infectious diseases, Japan contributes to MPOX response with vaccines, advancing through global emergency pathways and donations coordinated with partners. An example of science plus solidarity in action. For dengue, a tetravalent dengue vaccine from Japan has achieved broad approvals and is being introduced in endemic countries. It is a good case where long-term R&D paired with country implementations is starting to reduce the disease burden. For tuberculosis and AMR, new options for MDR, TB treatment, and novel antibiotics against serious gram-negative infections have expanded the global toolbox. In addition, voluntary licensing and global tenders have improved affordability and reach, helping national programs scale access. For COVID-19, oral antivirals licensed widely to LMIC manufacturers showed that public health-oriented IP strategies can quickly multiply supply while keeping quality and affordability in focus. These are not isolated product stories. They show a pattern R&D excellence aligned to access and delivery, so that products actually reach patients in LMICs. Beyond products, Japan's companies also invest in ecosystem, from partnerships and access mechanism to health system strengthening. Our industry supports three pillars: innovation and R&D, pipeline in vaccines, therapeutics, and diagnostics across entities, TB, AML, HIV, malaria, and emerging diseases. Access, flexible pricing, donations, and voluntary licensing. Collaboration with global funds and NGOs and product development partnerships to lower barriers to quality assured medicines. Partnerships, multi-stakeholder platforms, GHIT, DNDi, MPP, and others. Link Japanese science with global partners to co-develop and co-deliver solutions. These efforts complement UHC goal by strengthening regulatory pathway, quality systems, and delivery capacity, and because innovation is also about people who invest in the next generation. The next slide, a little bit the difference perspective. On World NTD Day, JPMA supports a national students contest that turns ideas into action. We engage students from middle school and graduate level, encouraging them to communicate clearly about NTDs and propose practical actions to accelerate elimination. This initiative builds awareness and leadership among young people, the future scientists, public health leaders, and policymakers who will sustain progress against NTDs and other infectious diseases. Transition from finally, let me conclude with where we go next. The last slide. Firstly, advanced innovation for unmet needs. We will keep investing in priority areas for LMICs, entities, emerging diseases, and pandemic preparedness responses, and align R&D with real-world use in health system. Second, co-create resilient supply chains. We will diversify manufacturing, pursue technology transfer and voluntary licensing, and partner with LMIC manufacturers. The goal is timely, affordable, quality assured supply close to where patients live. Resilience by design, not by accident. Third, strengthen multi-stakeholder collaboration. Japan's strength lies in trusted long-term partnerships with government, academia, civil society, and international organizations. We will deepen these ties to scale impact from clinical development to regulatory convergence, pharmacovigilance, and last-mile delivery. Fourth, expand access and support UHC. We will combine inclusive access models, digital health, and regulatory harmonization so that innovations are adapted faster, used safely, and reach vulnerable populations. Fifth, shift from aid to co-creation. The most sustainable progress comes when we work with LMIC partners as equal innovators, building scientific capacity, local manufacturing, and innovation ecosystem. This is how Japan will continue to contribute from science to systems, from products to people, ensuring that life-saving innovations reach those who need them most reliably, sustainably, and equitably. Thank you for the opportunity to share JPMA's perspective. We look forward to co-creating the next chapter for global health together.
Thank you very much, Dr. Nakagawa, for excellent interventions. The things that you listed on the future outlook, like advancing innovation, a resilient supply chain, strengthening multi-stakeholder collaborations, and expand access to, and support USC, and shift from aid to co-creation. I think those are very relevant recommendations and suggestions. Thank you very much. And also, I think it was kind of enlightening for many audience that the Japan's innovation, technological innovation, has already contributed so much for the improvement or betterment of the global health and the health of the world people. So I think I really appreciate your intervention. Thank you very much. So I'd like to go to the second round of interventions, maybe starting from the opposite direction from Dr. Nakagawa. So you talked about the importance of the partnerships and also the co-creation. And in line with the call for more sovereignty of countries, as well as the global effort to rebuild and reconfigure the global supply chains, there are increasing demand from low and middle income countries for local manufacturing of essential medical goods. So how are Japanese pharmaceutical manufacturers or industry trying to expand partnerships with those in LMICs through maybe collaboration in R&D, licensing, and technology transfer, and those things? So please, if you can provide some thought on those questions.
Okay, thank you very much for a great question. My answer is, since COVID-19, Japanese pharmaceutical companies supported by the Japanese government have increasingly shifted from a traditional export-oriented access model toward partnership-based local capacity building in LMICs. This shift aligns with LMIC demands for domestic manufacturing sovereignty and Japan's global health diplomacy agenda, G7 ticket, UHC, pandemic preparedness, and so on. Japan's private sector now plays a central role alongside public instruments such as JICA, which explicitly promote the technology transfer, joint R&D, and sustainable manufacturing rather than short-term supply donations. However, local manufacturing is not simply a matter of building a factory. It also depends on the maturity of each regulatory authorities responsible for ensuring that manufacturing processes, quality assurance systems, and regulatory compliance expertise. As discussed at the APEC meeting, bridging the gap between guidelines and implementation must be resolved collaboratively by industry, regulatory authorities, and academia. The Global Health Innovative Technology GHIT Fund is an important mechanism linking Japanese pharmaceutical firms with LMIC research institutions and manufacturers. GHIT finances joint R&D consortia involving Japanese pharmaceutical companies and LMIC public research institutes and manufacturers. These collaborations span the full R&D value chain. Licensing strategies are also important for enabling local production. Industry commitments have been discussed at G7 and IFPMA. Japanese pharmaceutical technology transfer emphasizes process standardization and GMP compliance, and workforce training and co-investment in production lines rather than contract manufacturing alone. This reflects Japan's regulatory culture, where manufacturers retain responsibility for end-to-end quality and safety. I'd like to share what distinguishes the Japanese approach compared to pharmaceutical companies in the US and Europe. Japanese manufacturers stand out in 4 areas. Firstly, strong public-private partnership, and emphasize gradual yet sustainable capacity building over rapid scaling. Willingness to integrate technology transfer, training, and licensing into a single partnership package. A tendency to favor long-term relationships based on trust, particularly in Asia and Africa. At the same time, we consider intellectual property protection important and prefer structured bilateral agreements that maintain quality control and regulatory authorities. To maintain a long-term partnership and LMIC health sovereignty, it is advisable to take these factors into consideration. Thank you very much.
Thank you very much. It might be a tough question for you, but we learned that the strength in the manufacturing capacity of low and middle income countries is not only about factory. We have to strengthen the entire ecosystem surrounding that manufacturing. So I think there might be an area that that we can work together between the JICA, like a public sector, and JPF or any pharmaceutical industry from a private sector, so that we can jointly strengthen the local manufacturing capacity of or create the ecosystem for local manufacturing capacity building. Thank you very much. So next, I'd like to ask Mr. Shibusawa. Thank you for enlightening about how the III is really expanding its membership and also engaging the tangible investment for making change in global health. But while income level of low and middle income countries is increasing, and their purchasing power is also increasing. Many people still struggle to pay for essential health services. That's also reality, and not being able to benefit from the technological innovations, for example, that Dr. Nakagawa shared. So what do you think is the kind of ideal financing modalities involving both maybe private and public sources, which can ensure both vibrant innovation at the same time equitable access? And how can we invite more Japanese investors in this course, and then also the investors from low and middle income countries? Since you mentioned, even in the III membership, many of the organizations are from the north, but we need to expand the reach to the north, maybe the global south. So those are questions to yours. Thank you.
Thank you. If I was Harry Potter, I would have my magic wand and provide you with a solution, but not so easy. But let me just tackle your very important question from two angles. The first angle, most of probably in the audience think of investors and in business people. They're only thinking about their profit return. Yes. Actually, it's not true. If that was the only thing they were looking at, they're not very good. They're not a good investor, and they're not a very good business person. Usually, we need to look at risk and return, perceived risk and real risk or perceived risk. And then the risk part is what I think gets in the way. Currently, launching have launched an impact fund into Africa under the Keizai Doyukai, the Japan Association of Corporate Executives. This is an impact fund into Africa. And we managed to start with 25 million with 7 Japanese corporates. But it's very, very difficult. When you go to talk to corporates about Africa and impact, they go, "Oh, Shibusawa-san, Africa is very, very far away. No, we're not ready for Africa yet." So the argument is that's why you should use us to explore that new opportunity. But that's always there. But this fund, this summer we should have the Africa Development Bank come in and hopefully JICA as well come in as co-creation partners for this. So this is a public-private sector initiative. For impact fund into Africa. It's not just global health, but it's around many issues. But based on that, though, still, Africa is 54 countries. Are we going to be investing all 54 countries? No, we'll probably be investing maybe 10 of the 54. In those countries, they're the city and the regional. I would imagine many of the investments will tend to be in the city. So we still have this divide, as you mentioned, of mass amount of people, population being left behind. So how do we tackle this? And I go back to the point that Itoh-san mentioned about this concept of blended finance between the public sector, which can de-risk an investment, and the private sector, which can provide more capital. Now, having said that, though, there are two different species. We don't talk to each other usually. So we need a common language. And that common language, I'm hoping that the impact IMM, the impact measurement, can be that common language to move this forward. Unless we have a common language, blended finance will not work, I think. So that's one point. Second point, currently we're having an election in Japan. I just checked on my ChatGPT to see if there's any political party, any politician mentioning the concept of global health. ChatGPT had a very difficult time with that question. Answer is basically no. Why is that? Well, because we can't get votes, they would say. Currently, well, we had 250 people, now we're 237 watching. Over 90% were from Japan. I saw Japanese names. Your interests are not being reflected by the representation that we're sending to the Diet. That's obvious. So what do we do? Well, if it's just 200 people, yeah, it's a very, very small minority. But if it was 200,000 people, 2 million people, yeah, maybe people start to take notice. And so what's the point I'm making here? Well, actually the global health sector is very, very important. I've been involved in it for the last 15 years, but it can tend to be very closed. The preachers tend to preach the preachers, you know, and it's a very hard hurdle for I think many people to come in. And so I think we need to make a conscious effort in the global health sector to lower that. And why is it important to save lives? We have to explain that in very simple language to people that only think about themselves, basically. And so I think it's also it's in our the ball is in our court as well as people that want to promote global health to say how do we lower that barrier so that more people can get more interested in this area because it's so important for our children and our the next generation.
Thank you very much. You know, I wanted to really break that small circle of the preaching to each other. So I think your presence as a private investor is really means a lot. And
Well, I've been preaching a lot.
Thank you. That's also good. And also this impact investment or impact management can be a kind of a common language linking between the private financing as well as public financing. I think that also gives us a kind of a clue for how we can work together for the future for the purpose of improving global health. So thank you very much. So Itoh-san, there's a question for you too. Today's the title of the seminar is actually a little in Japanese it's a little bit more provocative because it is like a challenging Japan's leadership in terms of the declining ODA. In English it's simply Japan's leadership, but there's Japanese is challenging. So I think I want to challenge a little bit. So what do you think are the requirements for Japan to be recognized as a leader of? Did I already ask these questions? How Japan can provide the leadership, continuous leadership in this arena. So thank you very much.
Thank you. Very good question. I think there are a few important factors for any country, not only Japan, for any country to be regarded as a leader of global health. One is funding. Money is important. In recent years, until 2024, Japan contributed to roughly $1 billion, $2 billion, $3 billion US dollars annually, depending on the year, to health ODA. And this is roughly 3 to 4% of the global development assistance for health. So 3 to 4%. So it's very important. Japan's money is very important. However, let me share a little bit surprising news, but Japan's recent pledge to the Globe Fund, eighth replenishment, was quite shocking, I'm afraid, because in dollar terms, the pledged amount was just half of the amount given for the previous replenishment round. It was the 1 billion, but it became 500 million. So I understand the fiscal constraints and weak yen or the mounting domestic challenges are the reason behind the drastic cut. But if Japan wants to maintain its position as an important middle power in the global health community, the funding level, particularly at multilaterals, matters. So that's number one. The second factor is I think the agenda setting capacity. So this is intellectual or political capacity for agenda setting, the G7 or TICAD or the UN, etc. This is highly important. So a country's ability to contribute this agenda setting, again, tied to the first point, is the funding. So it is indispensable. And third is innovation. So there are high expectations for Japanese industry to in terms of innovative technologies and products. So so your presentation was I'm so encouraged, and your presentation. Finally, I'd like to give the raised trust. Trust is the fourth factor. I want Japan to be a trusted partner of the countries. I attended large global health conference in Bangkok last week. It's PMAC. And the keyword I took away from that was trust. So one of the Thai experts mentioned in a session of global health architecture, I quote, "Trust is a new currency. Trust is a new currency." So how much trust we offer, how much trust we gain. So it may sound a little bit naive, but I really believe this should serve as a guiding light, helping us navigate this difficult crossroad to become the leader of the global health. Thank you.
Well, thank you very much. Very straight to the point, and I really appreciate your intervention. I was wondering, the way that trust can be monetized and traded, and I don't know, with the new development of financial technology, I don't know. But anyway, so those the amount still matters, and agenda setting capacities as well as also important. So thank you very much. So I'd like to turn to Dr. Aboagye. Thank you for waiting in Ghana. So listening to all those good words from Japanese presenters, what kind of a partnership do you expect with Japan and beyond? So floor is yours, Dr. Aboagye.
Thank you very much for the rich input we have so far. I think I just want to maybe respond to a few things in terms of Ghana's role in the reshaping of global finance. And briefly, just we've been part of SWAP. We were part of the Future Global Health Initiative. And then that gave birth to the JICA agenda, which is asking for to focus on health system strengthening, primary healthcare, domestic resource mobilization through catalytic export from ODA equity, and common systems to reduce fragmentation. And as we mentioned earlier, research and development where manufacturing comes in. There's also then there to the Accra research. I think the issue that we don't want ODAs. I think the word solidarity still represents that we need to continue, but it has to be country-led or had a country role, country priorities, and also we need to enhance domestic research. In terms of the expectation from us, as you asked, I believe that Japan, as we've been mentioned by our speakers, has played a major role in ODA, including sending experts, especially to my country, Noguchi, and your youth to rural Africa in areas where even citizens would rather not go there. Your support is needed more than ever now, and you can support to save very critical institutions and countries. Sorry. Yeah. So we believe that Japan should be part of the global push for reforms, which emphasizes sovereignty and self-determination, as I mentioned. And then Japan can continue to encourage its private sector in participating in supporting beneficial countries of ODA. I think we mentioned a few things, technology, and with technology and innovation, that is crucial if we are going to make proper use of ODA and also be able to be self-sustaining. There's also partnership is extremely important. You continue to do some of the good things you are doing, supporting primary healthcare, health system strengthening. These are the bedrock of any sustainable health system, and universal health coverage, which Japan assisted us, JICA assisted us in developing our own strategy, including setting up the essential services package. Japan, using its power and resources, can also play a catalytic role in domestic resource mobilization in the lower middle income countries because there has to be a lot of push to get some of these things done. And most importantly, I'll be saying that let's advocate for more of the reduced ODA, because one decisions have been maybe, the reduction is a reality, that the levels, enough levels of those ODAs really reach the countries or the lower middle income countries, so that doesn't get taken out of the, and even in the countries, let's ensure that, advocate that the significant proportion of money goes to where the issues are really needed. And I think these are the key role and expectations that we will have from JICA to continue to be the good partners we've always known, leaders that we can trust, and they should also trust us. So thank you very much.
Thank you very much for very good and insightful intervention from Ghana. We have some time left for probably interact, but not much time left. But we try to take some questions from the audience coming through the Q&A boxes, as well as some interactive actions. So before that, I'd like to ask Dr. Omi to provide some reflections, your reflections on listening to all the intervention from our panelists.
Thank you. Now, in my presentation at the outset, I said that this meeting takes place at a very timely manner. And as Itoh-san mentioned that a couple of months ago, Japanese government decided to reduce the Japan's financial contribution to global funds, that thing. And also this is timely. Of course, your plan went ahead of this current election. So you didn't anticipate that the election will come at the time. But, you know, next week, new cabinet will be more or less. So this is a very timely, and again, I'd like to congratulate you. But now, Itoh-san, in your presentation, mentioned that we need to come up with new sort of resource mobilization mechanism. Yes, because of the government, Japan's the budget is tight. I mean, we don't have abundant resources. We have to use it very tactfully. Now, Shibusawa-san, the point is that this impact investment. I am following your sort of presentation. I mean, you made a presentation again and many times in the past, and from time to time I followed up your presentation. And in this impact investment is some sort of idea that I cannot agree with more. Yes, this is a wonderful sort of initiative. Now, having said that, Takezawa-san, can I be a little bit more proactive? Not for to criticize anybody, but in the interest of the meeting. Now, you know, I have, in addition to my current position as a chairperson of the Japan Anti-Tuberculosis Association, I've been also chairman of the Nikkei Financial Times, the conference meeting, which lasted more than 10 years. And in that forum, from the very beginning, first one, which took place in almost 10 years ago, 11 years ago, they talk about importance of private-public partnership. They are fully aware of that time. Now, and in Shibusawa-san's presentation, you refer to the 3 pillars. And the last pillar is it's about the incentives that you have to provide to the private sector. I think that's a very powerful sort of a phrase. But, you know, in spite of the fact that the Japanese society has talked about this importance of private-public, you know, partnership, in my view, the speed of progress is not as much as we expect. Then Shibusawa-san today mentioned the need to provide incentives to the public sector. So I would be very grateful if you can enlighten a little bit on what kind of incentives that you envision, so that the private sector, of course, private sector main aim is profit making, but at the same time, they are interested in doing something better for the society. It's not the one or the other. So But if you look at the private sector, particularly health sector, they like to invest in, for example, vaccine development. But they are concerned about uncertainty of the demands. So that's why they are a bit, ambivalent. So in order to address that kind of ambivalent feeling among the private sector, what kind of incentive that Shibusawa-san believe that is very relevant in today's in response to today's reality? Thank you.
Thank you very much. So I think it's a question to Shibusawa-san as well as to Nakagawa-san. Yeah, probably. So Shibusawa-san first. Yeah.
Thank you very much for your question, Dr. Omi. I'll be kind of repeating myself, but it's about risk mitigation. And so one risk mitigation is what we call first loss, where an investment comes in. If it doesn't go well, the first loss goes to the public sector, and the private sector has some protection. That's one way. The other way, I would imagine, Dr. Nakagawa is more of an expert, but for things like vaccines, where there is a market, but you don't know when it's coming, and so people aren't ready to invest in that. But if there's a guarantee that a government public entity that says, we will buy that if it's produced, that's one way to incentivize, I think, the pharmaceutical sector. But I think you're the expert, so you should.
Yeah, thank you very much for your question, and I'm honored to explain the answer the explanation for the benefit of the pharmaceutical industry. If there are any outstating industry profits, we should avoid these profits. But please consider, could you please consider the cost of the to overcome the healthcare issue and the global standard? Even considering only the supply of pharmaceuticals and vaccines, it is a fundamental premise that realizing the entire processes from research and development through regulatory approval, pricing, procurement, technology transfer to local manufacturing takes a long time and take a huge amount of cost. Public interest in licensing, quality assured multiple supplier strategies, and joint procurement achieve price reduction, supply diversification, and quality protection. This is not merely an add-on benefit, but create social value. Starting from public health goals and using fair and transparent rules for both sides, it is important to ensure that choices are justified by their impact on collective health, not by excessive commercial narratives. The incentive is many means, but we would like to create more new medicine, new drugs and vaccines for overcome for the global health issue. Thank you very much.
Thank you very much. I think one of the value of having a global institutions like Global Fund or Gavi is to create the market for those products. So I think that also a mechanism to provide incentive for the manufacturer to contribute more. So I think there's a value in maintaining those global institutions. Of course, the bilateral like us is also, I believe is important, but the global institution is also important. So I think unfortunately the time is running up. So I'd like to ask each panelist as well as Dr. Omi to give like a 1 minute take home message to the audience. Maybe I can ask to start from Dr. Aboagye from Ghana. Can you give us a 1 minute take home message?
Yeah, thank you very much. I think I've said a lot, but I want to reiterate that I want to just reiterate that ODA is still very, very much needed for the lower middle income countries. The lower middle income countries part of the global economy. Maybe we may not be contributing a lot, but I'm sure we are contributing a lot of raw materials that help the economies to grow, and that solidarity should be maintained. It should also be a catalytic, play a catalytic role in ensuring and building capacity for domestic resource mobilization across these countries. And I believe that more countries should be able to join, a few more countries could join those making contribution to the overseas development assistance. Yes, and then of course, we will need to, as a country, support some of the very basic things that make health services cheaper and that makes it more accessible for our population as we move on. Thank you very much.
Thank you very much, Dr. Aboagye, for joining from Ghana. So, Ms. Itoh, please.
I'm sorry, it's takeaway message?
Yes.
Okay. So the Japan's leadership in global health, whose leadership we are talking about? Like this kind of discussion, we tend to say that it's the government decision, the JICA's, we want to do, it's a request for government, but everybody in the global health community has a right, has a role to take leadership and help people around the world to understand Japan's policy, and then make our effort more visible, and to let Japan shine. So it's everybody's effort. That's one message. And also, I noticed the one comment on the Global Fund budget reduction for the Ministry of Foreign Affairs, but unfortunately, Ambassador left. So please convey that message to them. Thank you. Thank you.
Shibusawa-san, please.
Great, thank you so much. As we know, the global health has been a strategy, foreign policy strategy for Japan since for the last 25 years, or from around 2000. So that's should be staying in place, right? Regardless of the change in the prime minister and whatnot. Another important, I think, initiative started in Japan was actually in 2007 during the first Prime Minister Abe's cabinet. This is the concept of FOIP, Free and Open Indo-Pacific. So we think of Indo-Pacific as Asia, India, but what's on the other side of the Indian Ocean is Africa. So it's actually to me it's a global South. Well, it actually includes Latin America as well. So it's a a global South strategy. So that I think is also very important in the current context. And I'm sure our current Prime Minister, being a student of Prime Minister Abe, understands this. And so using that FOIP framework, I think we need to probably incorporate a health corridor within that FOIP framework. And how can the private sector get involved in that? Well, things like digital, things like digitalization of health services, actually maybe microfinancing of services, logistics. These are things I think the private sector can get involved in this FOIP framework. So I think that's very important. Kind of forming this, in a sense, a global commons for this kind of corridor, and private sector. I think investors and corporations and startups can play a role. One last word is, having said that, it feels like the dark side is expanding. I'm actually more of a Star Wars fan than a Harry Potter fan, but it's monotone, right? It's like me first, all around the world. But you know what? I think people that are on the panel and people that are still with us, we're Jedi Knights. And if you look at Star Wars, Jedi Knights, they're not monotone. They're like very, very, very diverse. They have their own style of doing things. And so I think my final message is we still have the Force.
Thank you. Dr. Nakagawa, please.
Okay. Finally, I would like to point out that what is common sense in Japan is often a miracle to the world. We wish Japan's success in achieving, which has achieved the world's longest healthy longevity through universal health coverage and as a nation that fosters innovation with the world. Thank you very much. Thank you for your attention.
Thank you. So, Dr. Omi, please, for the final word.
I think we have to face with the reality that this world is, well, unfortunately divided. I think we have to accept the reality. And in my view, Itoh-san mentioned in her presentation that this may be a golden opportunity for Japan to take, well, leadership, even stronger leadership than ever before. I think in terms of economic power, I'm not an expert in economy, but it's not robust. We know that. But I think we have to understand and remind ourselves that through JICA, through other multi-layers support that Japan provided in many years in the past, Japanese society, Japanese civil society has so many friends. I'm sure that many of you visit many countries, but you notice Japan, yes, economy, yen is depreciated, but many people, whether you go to the Middle East, to Africa, Latin America, many people respect the Japanese society because of the past, the achievement, track record. So I think that, yes, many people in Japan think that the ODAs are, well, not necessarily, if I use the blunt word, waste of money and time. But these people who know the global reality, we have to, from time to time, talk to the people, not the division, but talk to the people. And they, we have to understand the sentiment of those people who say that ODA is wasteful. I understand there are some sentiment, but if you politely listen to them and talk to our sort of track record patiently, there's no shortcut. I think we have to continue to make this down to the earth effort so that the people will understand this is the time for Japan to take the even stronger leadership. Thank you.
Thank you very much. So we have force, we have trust, and we have friends. Thank you very much. So I'd like to invite Ms. Kamei, Director General, to give us closing remarks.
Distinguished panel members and participants, thank you very much for joining us today and for your active engagement throughout this forum, Global Health at Crossroads, Japan's Leadership and Era of Declining Global Aid. I'd like to express my sincere appreciation to Dr. Omi for inspiring keynote address, to all the panelists for their thoughtful contributions, and to our co-organizer, JCIE, for the strong partnership with us, JICA. I was also greatly encouraged by the affirmed commitment to global health expressed by His Excellency Oba Yuichi of the Ministry of Foreign Affairs in his opening remarks. Today's dialogue has highlighted that global health and development cooperation as a whole is confronted with significant turning point. Progress on the SDG has slowed, ODA is declining globally, and divisions in the international community are deepening. Yet at the same time, we are witnessing promising development, stronger ownership among low and middle income countries as presented by our friends from Ghana, innovative financing approaches and new opportunities emerging through private sector engagement and technical innovations shared by our panelists. From today's discussion, I came away with several important considerations for how Japan and JICA in particular should navigate its contribution to global health forward. These include clear prioritization, tailored approaches for partner countries, efforts for more innovations, more funding and blended financing, or building trust through collaborations. Yen may have been depreciated, but I saw that the trust has not been depreciated. That's something I strongly believe through the discussion we have today, and then we still have force to contribute to the global health. So as the global environment continues to evolve, JICA remains firmly committed to advancing human security and to co-create a more resilient and sustainable global society with trust. I hope today's forum will serve as an important step forward in our shared efforts and collective actions. Once again, thank you very much for your participation and collaboration. With this, I'd like to close today's forum. Thank you very much.